Okay, hello everybody. Thank you very much indeed for joining us this morning. It's 11:01 now, so we're gonna get cracking. So first of all, I just wanted to give a brief introduction to myself. So my name is Alice, and I founded Ripple and came up with the idea of Ripple back in 2020. We launched it in September of 2021 in memory of my brother Josh, who took his life in November of 2020. So today's session and kind of roundtable that you've all been kind enough to join us for this morning is all around the theme of mental health and particularly protecting employees' mental health. And I'm really fortunate to say actually that we are lucky enough to be joined by really the creme de la creme of well-being with our speakers today. So I will slowly introduce them one by one in a moment. But before we do so, I just wanted to encourage anybody that is on the call today to please engage with the session, ask questions in the chat throughout. If there's any comments or questions that you have for any of our speakers in particular, please do put them in there. We'll do our very best to answer them. And hopefully you will learn something and be able to take some key messages away for your own organisations after this webinar and this time that we have together this morning. So I mentioned we've got the creme de la creme of wellbeing professionals on the call with me today. So if it's okay with everybody, I would just like you all to go one by one with a brief introduction of yourselves and what organisation you're from, perhaps a little bit around what your role entails, and then we'll get started. So I'd like to begin with Nikki, if that's okay.
Thanks, Alice. Yeah, hi everyone. I'm Nikki Berryman. I'm Community Engagement and Employee Wellbeing Officer at Agilio Software. We are a tech company that provides back office support systems to clinicians in the healthcare industry. We currently employ about 230 colleagues across the UK and into the Netherlands as well. We're probably in the fairly unique position where about 70% of our workforce are fully remote and the remaining 30% are hybrid. I work as part of the central people team to help create and implement the wellbeing strategy for the whole group.
Perfect. Thank you very much, Nikki. Jenny?
Yeah, so hi, I'm Jenny Baker. I am the Mental Health and Wellbeing Strategic Lead for the Football Association. So my role is quite broad. It encompasses a wide range of responsibilities and it's continuing to evolve actually, which presents both exciting opportunities, but yes, some challenges maybe along the way as well. So I'm based across both Wembley Stadium and St George's Park. Our organisation is just circa 1,000 employees currently. And I oversee the implementation of our health and wellbeing strategy, which spans our FA employee network, the grassroots football initiatives, and our duties as a national governing body. Additionally, I also manage all our partnerships in this space, including our occupational health services and all the work we do in the community.
Thank you very much, Jenny. Simon?
Hello, and thank you very much for inviting me on the panel. It's terrific timing this week. I am delighted to be a board member at Ripple, representing and educating around financial anxiety. I'm the co-founder of Wellity Global, which is a workplace leadership, well-being and mental health training company that's now, we're delighted to say, in 80 countries. With about 200 trainers, 450 topics spanning everything from SME, public sector, up to some of the largest organizations in the world. And also co-founder of the International Advocate for Mental Health Training Programme, which is a global programme, co-founder of the Great British Workplace Wellbeing Awards. And I was honoured and delighted to be voted the Great British Female Advocate of the Year at the 2025 Businesswomen Awards.
Thank you very much, Simon. Now, for those of you who are eagle-eyed, you might have noticed that we're one person down on our panel this morning. Now, just to prove that this is a live webinar, things do go wrong. and Lisa, who is working in wellbeing within Heathrow Airport, unfortunately had a fire alarm that was not a drill just as we were about to kick off the webinar. So she's not here at the moment, but we're hoping that everything is okay over there and that Lisa can join us a bit further on in the webinar as we move through our time together this morning. So thank you all very much to the team who have joined me on this webinar this morning. I really appreciate you and all the work that you do and the fact that you've agreed to being a part of this with me. I think the first thing really that I wanted to go through is at Ripple. It's obviously Mental Health Awareness Week for everybody, and we're all celebrating that this week and trying to raise as much awareness as we can. But at Ripple, as part of this week, we did actually work with our partners to go out and conduct a survey, which over 2,000 UK professionals took part in. And the survey was all about workplace pressures, workplace stress, employee well-being, and so on. And some of the results that we have received back from that survey are quite shocking, actually. And some of the data and the statistics surrounding how people are typically feeling in the workplace is of concern. And I just wanted to highlight really a couple of those pieces of research that we've conducted and get the feedback really from the panel as to what their views and thoughts are on some of those results. So the first question that we asked the 2,000 UK professionals was, which of the following best reflects how you feel at your current workplace? And the options were calm and content, stressed and anxious, depressed, and suicidal. Now, alarmingly, 10% said that they either felt depressed or suicidal. 10%. 28% said they were stressed and anxious. So really shocking. 10% is a huge number to either be depressed or suicidal. And I'd like to just open up to the panel on that first question, if you've got any thoughts or comments. So I'm going to start, if I may, with Jenny on that one.
Yeah, it is a really shocking stat, Alice, and it's really sad to hear that in 2025 where people are still feeling that way, especially within the workplace. I can only compare it to where I am within the FA, really. I've been there for 15 years, so that's kind of a lot of my growing up I've done there and over time working within the workplace. But our in terms of our organisation and the 1,000 employees we've got, we're in terms of acute cases where we might be feeling kind of the self-harm, suicidal thoughts, we're at best around 1%. So quite a difference there to the research you've shared there. I struggle with this happening in the workplace. I mean, obviously the research came from breadth and depth of different organisations, different places. I suppose it just reinvigorates the reason for why we're doing what we're doing, and not just in the awareness weeks, but every day, all day. So but yeah, in comparison to where I am, it's quite a different space, I'm afraid.
Yeah. In terms of one of the other questions that we asked here as well, which also came out with quite interesting results, we asked everybody who took part in the survey if they've ever avoided talking about mental health issues at their workplace out of fear it would impact their job security or progression. And 45% of people said yes, they have kept their concerns to themselves, which again is a huge number, just under half. Nikki, I'm going to ask you about that one. What do you think about those results, and what can we do potentially to help people and encourage people to talk more openly in the workplace?
Yeah, I mean, those results to me, Alice, are really quite shocking, and actually similar to Jenny. I think they would be, well, I know for a fact those kind of results would be a lot lower in Agilio, but for me, I think Communication continues to be key. I think most businesses probably work really hard to bring conversations about mental health into the foreground. But I think the reality is it's a constant work in progress. I think we need to keep reinforcing the message. We need to keep updating resources. We need to keep sharing new learnings. And that's the challenge. It takes a huge amount of time and energy. Also, I think a real key consideration that I think some businesses might be missing out on is the support provided for line managers in terms of how to talk to their teams about mental health, what language to use, what questions to ask, giving line managers the knowledge and confidence to help them identify where somebody might be struggling. So we know that conversations around mental health should come from the top down, should come from senior leaders, but are we actually training our senior leaders to have those conversations in the right way? Those would be my questions, I think.
Yeah, absolutely. Thank you very much, Nikki. And I wanted to touch on one of the other questions as well. And Simon, this one is coming your way. So we asked the 2,000 individuals who took part in this survey that if you or a colleague were experiencing mental health challenges, do you believe that your workplace has the systems in place to provide timely support? 38% of people to that question said yes, they do. The rest of them said either that they could do more, they're unsure, i.e. they don't know actually what they have available, or no, they don't have anything in place and they don't have the systems available to them to provide that support in a timely manner. So Simon, what's your take on those results, and what more can employers and workplaces do to better support their staff?
Well, firstly, the statistics are shocking, terrifying, horrifying, but they unfortunately are not a surprise to me in the work that we do at Wellity. People at the moment are just feeling so overwhelmed and don't have the answers to questions, mainly because we don't know what the questions are going to be tomorrow. This is because there is just an incredible amount of change. And I think the reluctance to talk about mental health in the workplace is because probably people's jobs might be one of the main constants in their life at the moment with all the change going on. And that is one thing that they certainly don't want to disrupt in any way. I agree with Nikki wholeheartedly in that managers, I think 82% are accidental and many don't have the softer skills to actually have awkward conversations or approach the conversations. I think the three statistics are all intertwined, where people don't have the psychological safety to open up and they don't have the trust perhaps in the organization for the backing that if they do, then what is going to happen? And that is where I think we need senior leaders to come through and show that this is a safe place to be in. A doctor friend of mine recently said that 80% of the people he saw that day was to do with mental health or their mental health, and said simply our minds aren't wired for today's world. I think with so much change going on and within organizations as well, the barriers to talking about your own mental health can be overwhelming at time, and especially when people are withdrawing, maybe due to hybrid working and working from home, and feeling isolated and lonely, and that disconnect and connection is being reduced at work. So if we turn the conversation around and ask, why would they talk about it at work if they don't know what's going to happen, if they're unsure what's going to happen as well, then they presumably are adding to their or might be considered adding to their own anxiety and worry about where their job might go. So it is a terrible state of affairs out there. There is overwhelm is rife, anxiety is rife, and yes, more can be done, most definitely. Thank
you, Simon. All right, well, thank you for going through those kind of key findings really from our research that we conducted recently. The next really element of the webinar today that I wanted to talk about is the return on investment, or ROI. Now, that's a really sticky topic, I would say, when it comes to well-being and mental health, because how can you calculate the return on investment if people aren't opening up and aren't sharing how they're feeling. You never really know the impact that actually you might be having on people. And actually, from my personal perspective, what better return on investment is there than if your colleague is working to the best of their ability and feels supported in what they're doing in the workplace. So this is a question really to all of you. With ongoing budget pressures, which many organisations and many people on the call today will be feeling, how can HR and wellbeing leaders justify the investments in mental health initiatives? And that's open to any of you. And by the way, welcome back, Lisa. I'm glad to see you well and returning safely.
Thank you, Alice, and apologies everybody. We were all ready to go, and then the fire alarm went off. So obviously, safety first, had to follow the drill and evacuate. But we are all back in, all good. Thank you.
Excellent, thanks, Lisa. So, who wants to take that question then? How can HR and wellbeing leaders justify the investments in mental health initiatives? Open to you all.
I'll take. Sorry, go on, Jenny.
You sure,
Okay,
Nikki?
so I think mental health initiatives really should be framed as a strategic investment, not a cost. I think from a business perspective, it's about prevention. We want to retain our talent. We want to avoid unnecessary recruitment costs. We want to reduce the risk of stress-related illness and burnout. And at a very basic level, employees who feel supported in their mental health are more engaged and motivated, and therefore that's going to improve their performance and productivity. But more than that, we have a responsibility and a duty of care for our employees to provide a safe and a healthy environment. I think measuring the impact of mental health initiatives is really difficult, but there's lots of different metrics that you can use. So really obvious and basic things like sickness absence, staff turnover, retention, but also utilisation of support services, tracking engagement in wellbeing initiatives, and peer-led support groups, results of surveys or pulse surveys, that kind of thing, and asking for feedback on the ground as well from focus groups or wellbeing champs as to how initiatives are landing on the ground. So I think there's a lot you can do to measure how it's working, but the most important thing I think is benchmarking and tracking over time, because only by doing that can you demonstrate the true impact and identify areas that you can improve on.
Thanks, Nikki. And Jenny, have you got anything to add there?
Yeah, I just kind of second what Nikki said and just add potentially something else. But yeah, I don't think it's a compassionate choice. I think it's a really strategic imperative. I'm not sure if anyone's seen, Deloitte have just released their 2025 global survey, which looks at kind of Gen Z and millennials. And obviously these generations, I think they said by 2030 will comprise about 70% of our workforce. And the study put the spotlight on the fact that those generations are prioritising employers that demonstrate a real genuine commitment to well-being. So not just influencing maybe retention and engagement, but also that kind of top talent attraction. And they kind of spoke to the fact that there's this, they're kind of seeking this trifecta of money, meaning and well-being. So I suppose it just underscores that we should probably look beyond just kind of the mental health and wellbeing initiatives being about kind of just the support service, but more about maybe growth opportunities and the work-life balance, putting organisations in a much better place to kind of attract that talent.
Yeah, really good points. Thank you, Jenny. And just on the topic really of the kind of return on investment of mental health initiatives, it's always also quite a difficult thing to do when it comes to measuring the impact that they might make as well. So the next question that I have really for the panel is, how do you measure the impact of mental health initiatives? There's probably going to be many people on the call today who are really engaged with the topic of mental health and want to do more, but they need to show that it has an impact to their senior leadership levels and board levels in order to actually get it in place. So how would you say that we can measure that? And are there any specific examples where such investments in your organisations have led to measurable improvements in things like performance or engagement or retention? That's open to anybody.
I'm happy to go. Sorry.
No, go ahead.
Happy to go for just on the fact that sometimes that measurability, like Nikki and Jenny said, unfortunately is done in hindsight with what has happened. The thing about mental health support is that it depends on the buy-in, I think, as well, from the ELT and the why in which you're doing it. If you're doing it for 1 in 10 MHFAs, that's fine. You can do that. You can get those in place. If you're doing it because you care, then there's a far more, there's a bigger picture to that. And the definition of mental health as well, you know, someone's state of mind can open up all sorts of conversations about the intricacies of their work environments and around the business, from appropriate behaviors to burnout prevention and all the sort of accommodations that an organization can make. So we see a lot of we have a lot of organizations wanting to look at the ROI. Every training has to be monitored. The evaluation procedure has to be spot on before and after the session. So before any programs start, or it needs to have pulse questionnaires, or it needs to have some form of representation around where the organization lies, monitored before and after. It's very important to have 2 sat-nav codes: where we are now, which is a very frank analysis of where the organization is, and that sometimes can be very uncomfortable, and that sometimes is a blocker as well. It's holding up a mirror to the organization and to the performance or the buy-in of the ELT. And then we need a sat-nav code for where we're going. What does good look like? Where do we actually want to do? Is this just about performance, an upturn in performance, or is this about reducing absenteeism and really caring about the teams? So case studies, monitoring, pulse and private questionnaires. Anonymity is sometimes crucial when it comes to the monitoring and evaluation, not held in the room with senior leads, but some sort of anonymous evaluation. Split testing as well, anonymous links, follow-ups, because perceived culture can be very different to how it is actually being felt on the ground. And a real frank analysis of whether this is to do with just performance or to do with staff turnover, whether we want to increase engagement on sessions, which can come into some of the marketing and the internal marketing and the safety given to staff within the organization, and also let people know why you're doing it and what's going to happen, what is the plan. People won't commit, I don't think, to really opening up and being honest unless they know exactly what's going to happen with that data that they provide and what are the outcomes and the accommodations they're going to be made accordingly. So real communication for me and the team is to let people know why you're asking them to open up, what will be done with the information, and then the program of events moving through. It could also be, the ROI could be about reducing legislative cases. Sometimes it gets into the boardroom, unfortunately, because reducing around legislation, the reduction of libel cases, grievances, fines around appropriate behaviours, and just doing that box to stop complaints as well. That at least gets it into the boardroom, but we'd like to see the duty of care that's been mentioned previously as the main driver.
Yeah, thank you very much, Simon. Some really, really good points there. And Lisa, do you have anything to add from your perspective at all on that?
Thanks, Alice. Yeah, I think for me it was around an example that I thought just might help bring it to life in terms of what we've been doing here at Heathrow. So for the last 18 months, we have run a programme for our line managers. It's called Mental Fitness. It's a 3-hour face-to-face session designed to equip our line managers with the tools to improve their own mental well-being, but to also spot the signs and to have powerful conversations with their teams. About 70% of our line managers have gone through that. And what we saw is, as you said, Simon, about the measurement before and after, when we asked managers around their confidence levels to have a conversation around mental health, we saw a significant improvement from before they went on that programme to afterwards. Although it's very hard to say that one programme or initiative has has driven a significant contribution. It absolutely, I believe, has contributed to an increase in line manager relationship improvement, which we measure through our employee engagement survey. And also what we've seen over the last year is our average length of mental health absence decrease. So again, it's really hard to say this one programme has done that, but I absolutely believe it's been a contributing factor to that, to open up the conversations and to contribute to that improvement.
Amazing. Really difficult thing to do, measure the impact. So that's pretty impressive, actually, that you guys have managed to showcase that. I'm going to take one question now from the audience, and these are questions that were provided during the registration for the webinar today. So the question here that I'm going to ask the panel is, what's the best thing we can do in our organisations to help people? Anybody got any views on that one?
I think for me, it's just to continue to remove the stigma associated with mental health and appreciate that there's not one solution for everybody. I think it's that offering a range of products and services, encouraging people. And I think what we found really powerful is storytelling. So mental health is a really, really obviously sensitive topic, but where we have had some of our senior leaders and colleagues openly talk about their experience, what they've gone through when they've reached out to use some of the support services available, that seems to encourage others to come to the conclusion or come to the point that actually they would like to explore what that support could be for them too. So I think for me it's around just continually to find different ways to connect and engage with colleagues and normalise the conversations.
Reducing the stigma is still so crucial. We are still talking about mental health, and it is absolutely improving out there with regards to the topic area, but there's still a lot of work to be done. There's still people, as our survey demonstrated in the previous element of this webinar, where people still don't feel comfortable to talk about how they're actually feeling and opening up about that. So really creating an inclusive environment, creating that doorway really for people to feel like they can talk about how they're feeling without any retaliation and without any fear is really important. Anything, Simon, from you on what Lisa touched on there?
Agree completely with what Lisa said, and really there's a big initiatives around leading loudly now, and the one thing I'd say is to listen. And in order to listen, and I mean listen intently, I mean listen with care, diligence and attention, to want to make a tangible difference and not to put things in place just to fill a schedule, but to actually make those tangible difference. And to listen, we've got to ask, and asking can come in a variety of ways because everyone is different. Some people, we deal with global teams, we deal with UK teams, and whether it be culturally specific or within an organization, some people are happy to talk about things, some people aren't, some people want to be private, and some people will only talk after they're in crisis. So there has to be various streams to really reach those people before they get to crisis point, and that's through all means of engagement. It gets harder when we're remote working, when people are showing their show reels on computers and we can't quite read their body language, and so we'll come on to it later, but all of the different various engagement channels, and really listen to how people are, and lead loudly. It comes from the top. If people know that you can walk through a door, you can open up, walk through the door, and you're safe the other side, just like you said, Alice, that there are no ramifications, that you feel psychologically safe, you're leading by example, and others will follow. But that for me, leading loudly and listening.
Yeah. And I think just before we move on to the next section here, where I've got some questions for you within your own industries, I think it's really important also to say here that this shouldn't be a tick box exercise for any organisation. This shouldn't be something that you feel like you have to do. This should be something that you want to do and that you know is the right thing to do with genuine care and compassion. And I think that's really important to say as well. All right, thank you everybody for your insights there on a kind of return on investment. One next element really to where we want to take the conversation this morning is around cross-industry perspectives. Now, our panel speakers are from a very varied background, and that's very deliberate. They've all been invited very deliberately today to be on the panel. So I'm going to start with Lisa, Jenny and Nikki. And your question is, what are the unique mental health challenges within your industry and how are you addressing them? And we couldn't be really much more different with regards to a tech company, a football association and an airport. So over to you. I will start with Nikki.
Thanks, Alice. Yeah, I think a unique challenge for us is that 70% of our workforce is built through acquisition. So therefore, we're constantly integrating new colleagues and existing businesses into our company. And as I mentioned before, 70% of our workforce, again, is fully remote and 30% hybrid. So lots of different challenges there for us. But I think for us, it's about prevention and early support. So we developed a wellbeing induction program. So new colleagues have a series of one-to-one sessions during their first month with a wellbeing lead. And that helps to shine a light on the social and support groups that we offer from day one, so that people feel they're connected to their colleagues and the business from the moment they join Agilio. And it enables us to signpost people to support tools and resources really early on as well. And it helps us to connect with those individuals on a deeper level, so that we really understand their individual needs, so that we can provide more tailored support if we need to.
Thanks very much, Nikki. Jenny, do you want to go next?
Yeah, of course. So I suppose like most NGBs, we're a really high purpose, high stress organisation. The performance pressure and intense scrutiny, probably coupled with people's commitment to delivering that kind of quality consistently, can lead to very full buckets in our environment, and that obviously can have an impact on our wellbeing and performance. We've always kind of focused on building an infrastructure so that people have access to the support they need, and it was always about raising awareness, challenging stigma, delivering some education. But what's been really exciting we've just this last year embarked on our next 4-year strategy. We're trying to, although those previous initiatives are now kind of embedded, we want to move the conversation forward to really achieving that positive mental well-being. So very much more about kind of promotion and protecting and preventative, proactive care. And as to what Nikki said, we recognise that mental health and wellbeing impacts 100% of people 100% of the time, and really acknowledging that will look and feel very differently dependent on the individual. So I'd say in the last few years, but definitely this last year, we've kind of implemented a whole new range of initiatives. So I should have mentioned this, Alice, at the start when you asked me about statistics, but we have started to evolve a suicide prevention program specifically for our male leaders. Our demographic is about a 60-40 split, with 60% being the males, and our average age is around 39. And obviously we know those two stats kind of fit largely into kind of the key suicidal stats. So we've worked with Tough to Talk, an external organisation, to deliver some training internally there. And I suppose over the last few years we've evolved. We've got a mental health ambassador program that's evolved, and I suppose for us, one of our challenges is that's grown brilliantly, and there's quite a high demand for getting involved with that program. But as a result, maybe what it started out to be was a bit about, it was obviously post-COVID, so maybe it was just a bit about being curious about mental health and maybe how you could help yourself a little bit more, and maybe be able to speak more easily about stuff with a friend or a colleague. And definitely as that program's grown, we've got over 80 ambassadors now. What we're finding is it's fantastic. So we do it once a year. It's a 3-day program, very much focusing on kind of core knowledge, core skills, and then how you can apply that. And I suppose what we're finding now is there's now groups within that. So some that really want to kind of do the strategic change, the cultural shift, trying to really drive strategy. And then we've got those that just want to maybe have those kind of supportive conversations, maybe just in their team, just directing their teams, just making sure that people are on the agenda as opposed to just the BAU. So yeah, I suppose it's making sure we are agile to be able, and what's brilliant is they are driving that. We're not asking, saying that, they're requesting this. So it's very much about, it doesn't stop, does it? And it doesn't stand still. So just making sure we are meeting the evolving needs of our organisation.
Yeah, absolutely. And as you said, it affects all of us.
Yeah.
It doesn't discriminate, mental
Mhm.
health. So it can happen to any of us at any time.
Mhm.
Lisa, what's your take on that question, really, with regards to the unique mental health challenges within your industry?
Yeah, so I think at Heathrow, we are, I guess, a large and complex organisation. We're about 8,000 colleagues in total that are employed by Heathrow directly, but across the Heathrow campus, there's kind of 76,000 people, 400 different companies. So huge amounts
Not
of
many then, Lisa,
no,
really.
huge amounts of
Quite small.
different organisations involved. But I think within Heathrow, the majority of those roles are operational. They're safety critical roles. They're shift based. So trying to reach such a broad network of colleagues is a challenge. But if I think about the Heathrow colleagues in particular, and something that we have in place here is part of some of those roles mean that some of our colleagues are faced with some quite traumatic events during the course of their working day. So that could be responding to a medical emergency, could be witnessing a distressing incident, it could be supporting someone in crisis. So we have a really comprehensive and robust program called TRIM, so our Trauma Risk Management Program, which is our peer-to-peer network of great trained up colleagues who will offer that early support to colleagues who have been involved in any of those kind of incidents. So our processes and manager will refer anyone who's been involved in an incident into my team who manage TRIM, and they will then make contact with the individual and offer them to have a one-to-one confidential conversation about what they may have seen, and just, I guess, really understand, offer, as we said earlier, that really listen to what's happened, offer guidance, signpost into further support. And I think that's really fundamental for us within our organisation. We're also now thinking about how can we be more proactive in that space because of the reoccurring trauma. So sometimes people see events over multiple times and actually they might say they're fine, but what's the impact of that? And actually, what can we do to be more proactive in that space and really open up and engage those conversations? And as I said, we're across multiple organisations. So what we do is regular forums and calls to kind of share best knowledge, practice. What are we doing in our organisations? And that's really important for us too.
Yeah, love that. Thanks, Lisa. Simon, next question's for you. Now, you mentioned at the top of the call that obviously the co-founder of Wellity, and your global work spans across 80 different countries and more. So I guess my question to you with that in mind is what can we learn from international best practices and culturally inclusive approaches to well-being? Because as Lisa's just touched on, if all people have got an organisation that spans across multiple geographies and territories and so on, that can be tough, right?
It's probably thank you. It's probably the biggest indication that one broad brush isn't good enough for everyone. You said that mental health is different for everyone, and it is. It's so intersectionalized as well, not just within the cultures, but within various demographics. Wellity Global, probably I would suggest 75 to 80% of our clients are global or have global teams, whether that be HQ'd in the UK or otherwise. And all of their teams need to feel, all of the individuals within the individual teams and territories need to feel as if that training or the concern is reflected to them individually. So they need to feel heard, represented, and understood. You know, even clients of ours, I don't know whether it be an Amazon or a Nokia who have various territories around the world, all of their training will be different, specific to those cultures, and that's why we have trainers in all different languages, because I suppose that could be the first barrier as well, is actually hearing it in their native tongue with their culturally specific. Well, mental health maturity differs in various territories. If I just pick USA versus India, for example, the mental health maturity, the ability to speak out, the terms of openness of conversations differs wildly. And if you go in with a trainer that's not from that culture or representative of that culture, it could land terribly. It could really do more damage with training, especially when you're trying to express a concern, but you're completely off key with what that culture is. Topics with differing belief systems and expressions include most certainly around finance, around financial anxiety, the ability to talk about money. That differs. So each training is different in every different territory. End of life, some celebrated, some not, the way they talk about it and actually the attitudes to that. Men's mental health and the ability for certain men in certain cultures to talk out, completely restricted in some are really overt in others. Women's physical health can differ wildly between cultures as well, and the stereotypes and wanting to talk out about it. Gender stereotypes, working cultures and politics are probably amongst the most obvious difference, as well as obviously the language barriers, but also, which we do a lot of work on, is intersectionalized throughout the different cultures. Everyone is represented very differently because of social mobility, ethnicity, sexuality, gender, the way they talk about it. So we have to do a lot of research. We have to get a lot of intel from the trainers and the providers within those cultures that we use, so that it absolutely lands. I think once you get in through the door and you gain someone's trust to go in and talk about any sort of gain their trust and talk about any sort of training in and around the subject of mental health, it's really got to land. Otherwise, it's when we talk about engagement levels, they'll very rarely come back for round 2, 3 or 4. So yeah, very specific.
Yeah, and we've seen similar, to be honest, with our work at Ripple. We've got really fantastic engagement and traction from certain countries and territories who are quite forward thinking and wanting to do more to prevent suicide. In other countries and territories, it's just been an absolute no-go. Do not want to talk about it. It's extremely stigmatized, and it's just a topic that's completely out of bounds really for them. So it's very tricky to get it right across different geographies, and as you said, there's a huge amount to that. It isn't a one size fits all, and it's something that absolutely we all need to be conscious of, I think, when we're talking about our own work. All right, so the next kind of section really then to this webinar is around emerging trends and innovations, and this is open to all of you on the panel. My question to you is, how is technology and tools like Ripple reshaping the way that we support employee mental health? Who wants to take that one? I'm going to pick on you, Nikki, because you're from a tech company.
Thank you, Alice.
You're so welcome. You're so welcome.
So I think, similar to Jenny, really, the pace at which we work can be a massive challenge. There's no getting around that. So the question that we keep asking ourselves is, are we reaching everybody? And so for us, really simple technology, to be honest, like Teams, helps us to stay connected with colleagues who work remotely, because we know that feeling part of a community, having space to be seen and heard, makes a massive difference to people's mental well-being. So, using technology in a really straightforward way to create a range of virtual spaces for people to connect is really important, and something that we do. But the balance really, I guess, is to ensure that there's always that human touch point as well. So trained managers, mental health first aiders, peer networks, all of that kind of thing, and the ability to signpost people to face-to-face counselling or therapy if required as well.
Yeah, and you've touched on a really topical point there, Nikki, actually, because the way technology is rapidly advancing at the moment, the world of artificial intelligence, machine learning and so on that's going on out there, the question has arisen many times, and I think it will continue to do so, around how can we balance the effectiveness of technology, but actually also the need for the human connection here as well, because I think that's really, really important. Jenny, do you want to take that one?
Yeah, yes. I've just, as Nikki was talking, I'm just thinking, so this last year we've transformed our EAP. So we now partner with Headspace. So we're making much better use of our digital healthcare to upskill our people. And what they're really good at is kind of helping find the right level of support for their day-to-day lived experiences. A little bit that I was sticky about was the fact that they have just launched an AI empathetic tool on Headspace called Ebb.
Okay.
And it links to that point about the balance around, because we know health and well-being are predominantly social functions. So I would be honest, I was very skeptical when we first started talking about it together. But what we're finding is people are using it, and for that instant, I'm being very honest, it's just literally a companion, a reflective tool. It is absolutely not offering any kind of diagnosis, but what it is enabling people to do in the moment, if they are feeling something and maybe there's nobody around or they don't feel they can talk to someone, they've got somebody online that they can just have that, and it literally is instant feedback. And it does seem to be, again, with the demographic we've got, talking about those Gen Z and millennials, it does seem to be opening a door for conversation in that space. So I'm probably converting my own, I suppose, not fears, that's a bit strong, but slight concerns about where this was going. Because Nikki's absolutely right. For me, the human connection is still massively important. And I suppose it's about making sure it doesn't compromise any human elements, because we know that's where kind of the fostering trust and well-being really engages. But I suppose it's about how it can kind of complement us as humans, as opposed to replacing them. But I appreciate it does enhance efficiencies, which we can all maybe use in this very VUCA world we live in.
Yeah, absolutely. And it's an option, isn't it, for people?
Yeah.
Some people might find that really useful, and if they do, it's there for them. Others, that it might not be for them. It's a bit like any service, right? Even on the Ripple tool, we've got options there if people want to use a helpline, but actually, if they don't feel like they can talk, we signpost to Shout over text, or Calm through the web chat facility, or apps like the Grassroots Stay Alive app, as an example. So I think it's about giving people an option and a choice, actually, as well, about what works for them. But I think this whole topic area of tech and human interaction is so widespread, and I think the way technology is going, it will only continue to grow. Any comments, Lisa, from your end on that?
I think I absolutely agree with what you said. I think it's about choice. I think it's about understanding that different people will have different preferences, and that's absolutely okay. So I think it's about not pushing people to one or another. It's about opening up the variety of options for people. At Heathrow, we have, I guess, launched what I would say more of an enhanced a more holistic approach to what would be a traditional EAP. So we have now one provider who offers EAP, virtual GP, second medical opinions, access to physio, but also now starts to go into some of that preventative space as well. So it's the ability to speak to a nutritionist 6 times a year, to speak to a life coach, to speak to a personal trainer. So we're trying to encourage more of that, and that probably hasn't been taken up as much as we'd like, but we continue to push that. But I completely agree. I think we will never remove the need for human interaction. It's absolutely vital. But people are now using more apps, more personal devices. AI continues to evolve at pace, and I think it's how do we try to embrace that and understand how can we use that to monitor and understand the health of our colleagues and create an environment where they're willing to share that, so that we can then tailor some of our programs and initiatives to best support them. So I think there's huge opportunity there, but I think we're yet to really establish how that tech can really add that value.
Yeah, absolutely. Simon, what's your take?
Well, it'd be easy for me just to say I agree with everyone else. I completely agree with everyone else. And I may get brownie points here for saying I think the first thing anyone should do is get Ripple installed for intervention and prevention purposes. The work that you're doing and the importance of it is off the chart. I think when it comes to tech, it is a blend of the two. It's about human touch and the tech. It comes down to education. You can really educate people through tech. Sometimes it won't necessarily cure it. But what is mental health? Well, it's feeling unhappy, it's feeling down, it's feeling anxious, it's feeling stressed, it's feeling guilty, it's feeling worried. All of these things are expressions. They're human expressions, which can only be expressed by humans. And when someone says, "How are you?" and someone says, "Oh, not too well, a bit shoddy, actually," the other person suddenly feels safe enough to go, "Do you know what, me as well?" And you don't get that necessarily just solely through tech, but you can get the education around what is mental health. So I think the tech can enable and promote social interaction via the various LMS platforms. It can be a great way to reach people, those hard to reach people, but senior leaders going first to create those psychologically safe environments. as a whole, humans are people powered. That's the way we were made. We're human beings, we're not human doings. And when we think back to when we're thriving, you know, when we were once having fun and engaging and everything else with big smiles on our face, we were getting immediate feedback from people. We were having we had purpose and passion. Are people getting the same with 10 hours in their spare bedroom? Just think of it physically and physiologically, at home with challenges around them, on a Slack channel with no water cooler moments. So I think we need to add that fulfillment and effectiveness and human touch through face-to-face training, through one-to-ones, through engagements, through peer groups, which everyone else said as well. But I think that there is an element where we can reach people through tech and some of the e-learning, but I think the real wins, and if you're after data to make that impactful, tangible outcomes, and you really care, then that's all about connectivity and bringing people together and reminding ourselves that we are humans at the end of the day.
Yeah, absolutely. I'm going to finish off this particular section with a question, if that's okay, from the audience, and this one is from Hannah, who's just added this into the chat. She said she's just about to take on wellbeing under her remit. What's the first step that she should take to shape her mental health strategy? And you couldn't really ask a better audience, I would say, Hannah, for that. So who would like to take that?
I can't let that question go without saying, give us a ring. It's what we do at Wellity day in, day out. You know, pitch over, give us a ring. We'll have 10 minutes with you. We can give you templates, systems, procedures of what works in different industries. From probably 25 minutes, half an hour of data intel. It's something that we get asked all the time. I've got all these ideas. Where do I start? Well, let's start just putting it down on paper and we'll shape it from there.
Yeah, and the stuff that Wellity offer, the whole breadth actually of all of the different topic areas that they cover is just huge. So yeah, a great place to start, I would say, and we'll share Wellity's and Simon's details after the call as well, so you can get in touch with him. But Lisa, I'm keen to hear what your perspective is on this one from your perspective.
So I think for me, my advice would be to also look at it more holistically and think about all of the other components of wellbeing when you're thinking about your mental health strategy. So at Heathrow, our definition of wellbeing is the combination of individual and organisational factors that enable you to thrive. So our plan is very much built around 4 key elements. One is around healthy minds, one is around healthy bodies, and for us they are individuals' responsibilities, but that need to be supported and enabled by the organisation. And then we have organisational responsibilities, which is about healthy work and healthy team, and ensuring that actually as an organisation we understand where those stresses are, we understand the job demands of those roles, and actually we're looking to how we can continually improve those so that they don't cause stress or issues or concerns with individuals. So I think it's about absolutely mental health is paramount, but don't forget the other things that have a massive contribution to that.
Yeah,
great point. What do you think, Nikki?
I think it's really difficult to try and get the balance right. I think key is understanding the specific needs of your workforce so that you're actually providing targeted initiatives and not creating solutions to problems that you don't actually have. But also going back to what Lisa said about taking a kind of a wider, more holistic approach as well. So therein lies the contradiction, doesn't it? Trying to get that balance right. And I think my overriding advice really and truly would be call Simon. He's brilliant.
I think we're all going to be calling Simon after this just to check and validate what we're doing.
He's so generous with his time, actually, and very knowledgeable. So definitely call Simon.
Thank you very much. It's only because it's what we do. We've got case studies that can save people a lot of trial and error. And the quicker you get to helping people, our strapline is better every day, helping people be better every day. And the quicker we can get you to that point, the better. And congratulations for starting and caring. We'll do the rest and we'll help you.
Yeah, thank you very much, Simon. Jenny, have you got any thoughts on that from a kind of strategic remit perspective?
It would be similar to what everybody else has said, but the needs assessment was really crucial for us when we started to kind of identify what we wanted to target, because let's be honest, you could probably do something every day of the year for somebody in the organisation. And I suppose it's been a bit more targeted and strategic, knowing that you're only potentially one person trying to support the whole organisation. And I suppose the only thing I would add is I think one thing that really helped us was we got a range of diverse perspectives as part of that needs assessment, different experience, different backgrounds, to really make sure as much as possible you kind of fit for purpose across the organisation, and really meeting the needs of those demographic groups was super important, and also does help crystallise for you potentially what kind of key themes you might want to go after in that space.
Yeah, absolutely. And I think just to finish on this particular point, and it goes back to you kind of getting wellbeing under your remit, Hannah, from your question. Actually, looking after the well-being of an organisation is quite a responsibility. So just bear in mind that actually you need to be looking after your own well-being as well as other people, because it goes back to what Lisa mentioned earlier. Sometimes within your working day you might actually have to deal with some pretty distressing, hard things. So just make sure you're putting on your own oxygen mask before others in your role, because it is tough out there, and thank you for everything that you guys are doing. All right, final question then is, looking ahead to the next 3 to 5 years, what would you say is one bold action or innovative idea that you believe organisations should adopt to significantly enhance their employee mental health and well-being? And I will start with Simon.
I would say, very frankly, ask your team, but I think you need complete honesty. You're not always going to like what you get back. It may be because of what's happening in the organization. Ask your team. Opinions can vary wildly between ELT and all employees. It does require an investment. It does require trust. It does require safety and psychological safety, but how are people meant to know what to do if this isn't communicated? So let's go back to communicating, to getting face-to-face or virtual training, but getting people together, connected, because without that, and also with anonymous links as well, but you do need feedback for anything. I completely admire anyone in this space who's trying to help their teams and employees. You are right, you can't do it on your own. You need to take stakeholders with you as well. And get the buy-in from the team. So real clarity around communication and taking stakeholders with you. And that starts through conversations, and very, very frank conversations as well, which we can with.
Thanks, Simon. Nikki, any views on that?
Yeah, I think if we're talking about one bold action to enhance employee mental health and well-being, I would say it's a 4-day working week. It's something that continues to come up for us in our surveys all the time. I think it would create a better work-life balance, give people a greater sense of control over their time. The UK's 2022 4-day week pilot demonstrated a significant reduction in employee stress and burnout, with some companies reporting 71% decrease in burnout symptoms. So I appreciate that might feel like a massive challenge and kind of a massive thing for some businesses to even consider, but I think a 4-day working week would make a significant impact.
Yeah, absolutely. I'm still an advocate for the 1 or 2 day working week, but it's not running at the moment, unfortunately. All right, well, we're at time, so to everybody on the panel, thank you so much for joining me. Obviously, this is Mental Health Awareness Week. Cliche, I know, but it isn't just about talking about mental health during this week. This is something that we need to be doing all of the time for all of the reasons that the panel have mentioned on today's webinar. A huge thank you to everybody for taking the time to dial in and listen to what everybody has to say this morning. Thank you for everything that you do and for your interest in this particular topic. And we will close the webinar off. But thank you everybody again for all of your time.
Absolute pleasure. Thanks so much, Alice and Ripple, for this. Brilliant. And everyone on the panel.
Thanks,
Thank you very
everyone.
much. Brilliant
Thanks,
opportunity.
all.
Lovely to talk to you all.
Yeah, appreciate it. Thank you.
Thank you.
Take care. Bye.
Bye.
Bye.